Hello, and thank you for watching this short presentation on some of the tools that one might use to stay well and healthy in day-to-day life. My name is Carmen, and I work for the Health and Social Care Alliance Scotland, also known as the Alliance. As part of my role, I work on a project called Discover Digital, which aims to raise awareness of various digital health and care tools available to Scotland's citizens. So in this short 15-minute video, I will talk about some of the health, care and well-being tools and services that are widely available for anyone's use. I will focus on three themes: how to find trusted health information online, how to use the internet to find out what support is available in your community, and finally, some tools that can help people with long-term conditions or specific concerns keep well. So to start off, for anyone based in Scotland, Nhs Inform is the best source of health information. You can access it at nhsinform.scot. Here you can find information about illnesses and conditions, symptoms and self-help, tests and treatments, advice on healthy living, or even information on care, support, and your rights. There is also seasonal and topical information that is refreshed frequently. You can find the information that you need by clicking on these categories or by using the search function. They also offer information and advice on certain issues, such as the falls prevention campaign pictured here. This resource gives a wealth of information and videos you can access and share with anyone who might need it. More advanced functions of this website include the Info for Me tool, which you can use to add pages to a list and then print or save them all in one go. Nhs Inform also hosts Scotland's service directory, which allows you to look for services in your area using your postcode. The Nhs Inform website contains a true wealth of information, and some of it is available in alternative formats and languages too, including BSL, audio, easy read, and various translations. Moving on to the second topic, I would like to introduce you to ALICE. ALICE stands for a Local Information System for Scotland, and it is a program funded by the Scottish Government and delivered by the Alliance to help people find and share information about community groups, activities, and services that can support health and well-being. This can include a wide range of resources that can help people live well, such as those that help people self-manage long-term conditions, those that enable social connections, such as peer support, community choirs, befriending services, those that support outdoor or physical activities, such as badminton clubs, community gardens, or those that link to a range of practical support. You can access all of this on www.alice.org, but also through the Nhs Inform service directory, which I mentioned previously. Scotland's service directory includes all the information that is hosted on ALICE. To find a community resource directly through ALICE, however, the easiest way is to type your postcode in the search box as shown here. This will return a range of resources, which you can then filter by category, distance, or remit, or even by keyword. Here, for example, we search the list of results using the word food, which then narrows down the results to a more manageable list. And then, if you see something potentially useful, you can click on the item to find out more information, such as a description, contact information, or even go to the service's own website. And if you want to find out how to get to the service, just click on the location link, which will open up as a destination in Google Maps. As before, there are more functions to ALICE, and I would strongly suggest that you get familiar with the website so we can potentially support others use it too. And finally, here are some examples of online and digital tools related to specific conditions that people can access for their health and well-being. I will start with mental health, and there are various tools available online to help with mental health provided by charities, NHS, or private developers. For example, Brothers in Arms is an online platform and free app developed specifically to support men to manage their own mental health. You can find out more by visiting www.brothersinarmsscotland.co.uk. The Samaritans have also developed a free self-help app. With it, you can record your mood every day, look for patterns in how you're feeling, make your personal safety plan, and store images of things that give you hope. There are also services that you can access through the NHS, such as the Computerized Cognitive Behavioural Therapy services. These are highly effective interventions that are now available throughout Scotland in various forms. You can speak to your GP to find out what is available in your area. And if you or someone you are helping is in crisis, it is important to know the support is available. Once again, Nhs Inform can signpost you to useful 24/7 resources. In terms of accessibility, for people with long-term conditions, disabled people, or those with learning disabilities, day-to-day living can often present quite a few barriers. The following apps or services can help make daily life just a little bit easier. Welcome by Neatbox is a free app which helps people with accessibility requirements to request visits to participating venues and indicate the assistance that they require. Venues are notified of the request and receive an overview of the person's condition and top tips to aid their interaction. Find out more at www.neatbox.com/welcome. Be My Eyes is a free app that connects blind and low vision people with sighted volunteers for visual assistance through a live video call. So this can be used by blind and low vision people to get help to solve all sorts of tasks, big and small. Find out more at www.bemyeyes.com. For people experiencing hearing loss, Chatable is an app that provides enhanced sound, reducing background noise and enhancing speech in difficult listening situations. The app is suitable for any level of hearing loss, volume boost and background noise adjustable settings, and could prove very useful at this time specifically when people are talking through masks and in busy places such as supermarkets, hospitals, or even pubs. To find out more, you can go to www.chatableapps.com. In terms of apps specifically developed for long-term conditions, there are quite a few to choose from. Some are free and some are paid for. For example, www.mylungsmylife.org is a free website developed by Chest, Heart and Stroke Scotland. My Lungs, My Life is a comprehensive website for anyone living with chronic obstructive pulmonary disease, asthma, or for parents or guardians of children with asthma. My Lungs, My Life can enable people to understand more about their COPD or asthma and can help them to use self-management effectively. Another web-based resource is the COVID-19 specific page for people living with COPD developed by Formatics Limited here in Scotland. It can offer useful information for the times that we currently live in and is updated by artificial intelligence based on the latest guidance and information. Access the resource at www.med-ai.uk/COVID. My Diabetes My Way is the NHS Scotland interactive diabetes website that can help support people who have diabetes, their family and their friends. On this website, you can find leaflets, videos, educational tools, and games containing information about diabetes. You can also use this website to view your own up-to-date diabetes clinic results if you are signed in, which can help you manage your condition more effectively. www.mydiabetesmyway.scot.nhs.uk. For those willing or able to afford to pay for an app, there is a suite of apps developed by the company MyMHealth, which offer education, rehabilitation, and self-management for asthma, COPD, diabetes, and heart disease. Each app has been developed with clinical experts to provide knowledge and support to enable effective self-management. They include advice and video guides, as well as several personalization options. Each app is, however, priced at £39.99. To find out more, you can go to www.mymhealth.com. Moving on to physical health, there are two NHS-endorsed resources that I would like to highlight. The NHS 24 MSK Help app was developed with the help of Scottish patients, doctors, MSK therapists, pharmacists, and employment services. The information contained in this app is linked to muscle, bone, and joint self-management information on Nhs Inform. The app can help you find advice on common muscle, back, and joint problems, exercises and video clips to help you move safely, information for employees, managers, and employers, reminders to do exercises or attend appointments, and a log to keep note of your progress. You can find the app on the NHS Inform website. fallsassistant.org.uk is another NHS-approved website and has been put together by a team of qualified physiotherapists. It offers information on how to prevent and manage falls, but also two fun games to help you identify and learn more about fall hazards in and around the home. With regards to medication management, we all know that taking multiple medicines at a time can have certain side effects or cause complications. It is important to know about your medication, organize and plan it effectively, and take it as prescribed by your GP. However, that can be quite a task, so it is possible to use a smartphone or a tablet to manage your medication. Care for Today is a health management app that's been reviewed by clinicians and is currently endorsed on the Nhs Inform website. You can access it at www.carefortoday.com. If you are looking for an app to help with communication needs, Talk With Me app has been developed by Chest, Heart and Stroke Scotland for people who have had a stroke resulting in a communication difficulty. Having a stroke can make it difficult to speak, understand speech, read or write, so the app uses symbols, images and photographs to help with conversation and basic communication. It is free to download and you can find it on the Chest, Heart and Stroke Scotland website www.chss.org.uk. Another interactive communication resource is provided by Tokenmaps, who have developed a set of picture communication symbols which can be accessed as a physical resource or as a digital app. It can be used for consulting children and young people, used as a communication resource for people who have had a stroke, or used to overcome communication difficulties for people with learning disability or dementia. The communication symbols have been proved highly effective, and you can try them for free with the free taster version of the app or the light version of the app, which is available for £5.99. You can find out more at www.tokenmaps.com. Finally, I wanted to highlight a resource related to recovery. Should someone you support have been hospitalized or been admitted to intensive care, getting back to normal after such a traumatic experience can often feel quite difficult. Critical Care Recovery is a website which has been developed to offer information, advice, and support on recovery after intensive care. It provides advice from people who have been through an intensive care unit, their family members, and healthcare professionals. And once again, there are useful articles, videos, and further resources available on the website. You can access it at www.criticalcarerecovery.com. So thank you for listening through this run-through of potentially useful tools. And I want to remind you that this is just a snapshot presentation. There are plenty more out there, and there is also a lot more to each of the tools that I very briefly touched on. However, it can be quite overwhelming trying to find the right tool for an individual. And here at the Alliance, we are currently working on developing some guides to help people better understand where to find such tools and how to use them safely and effectively. If you would like to be part of this work or help shape its direction of travel, please do get in touch with us using either of the email addresses provided. I will be very glad to hear from you and to collaborate with you on this. Once again, many thanks for listening, and I hope you found the presentation useful, and please do get in touch should you have any questions.